Hi, my name is Dr. Noha and I provide health and wellness education content. Welcome to my channel. It's February. February is Heart Health Awareness Month. So today I'm going to be talking to you about some important things on how we can improve our heart health. So why is this an important topic? Did you know that the rates of cardiovascular disease are rising in young adults? So why is this? Well, we are not taking good care of our health like we should, and we're not tackling some of the heart disease risks. So I'm going to talk to you today about what cardiovascular disease is and what we can do to improve our health. So let's dive in. And before I continue, I just need to mention that this is purely for health education content and not medical advice. So what is cardiovascular disease? So cardiovascular disease is really quite a broad term, and it includes quite a range of diseases that occur. So when we talk about cardiovascular disease as a broad term, it could include some of these things I'm going to mention now. For instance, coronary artery disease or coronary heart disease, which is blockage of the heart vessels. It could include a valvular heart disease, which is disease of the valves in the heart. It could mean congenital heart disease, which is heart disease that somebody is born with. It could include stroke, peripheral vascular disease, diseases of the veins. It also could include heart failure, as well as subclinical atherosclerosis. So atherosclerosis is blockages that can occur in blood vessels, and I will show you what this could look like inside the blood vessels. You can see here is buildup of these plaques and then blockages that can occur. So let's go on and talk about some more things, useful things. I want to make sure you take home with you some useful and practical pointers. So many people think cardiovascular disease is a disease of aging, but as we can see, these conditions are occurring in younger people in their 30s, 40s, and 50s. So cardiovascular disease isn't exclusive to older adults. So data shows that cardiovascular disease and cardiovascular disease mortality are increasing in younger populations. So as mentioned, February is Heart Health Awareness Month. It's very important that we take charge of our health and adopt some healthier lifestyles and healthier decisions. So let's talk about women and heart disease. So women who have elevated cholesterols, elevated glucose, obesity, and who smoke cigarettes have a higher risk for coronary artery disease than we see in men. And women are also at risk for coronary artery disease if they've had early menopause, or they have polycystic ovarian syndrome, or they've had some complications of pregnancy, which could include preeclampsia or hypertension in pregnancy, or diabetes when they were pregnant, or even if they've had preterm delivery or low birth weight deliveries. So also important to know that cardiovascular disease is so common in the United States. Almost half the adult population has cardiovascular disease, including hypertension. And also, I want to tell you that out of 4 adults, only 1 out of 4 adults with hypertension is what I mean to say, only 1 has blood pressure that is adequately controlled. So majority of people with hypertension diagnosis do not have their blood pressure under control. So cardiovascular disease is a big problem in the United States, where 1 in every death in the United States is caused by cardiovascular disease. So there are risk factors for cardiovascular disease, and some of these risk factors include elevated cholesterol, elevated blood pressure, elevated glucose, lack of exercise, so sedentary activities, and a poor diet, as well as smoking cigarettes. So poor diet, obesity, sedentary lifestyles create an increased risk in cardiovascular disease. So when we know these things, then we know we can do something to reduce our risk of cardiovascular disease or coronary artery disease. So some of the things we can do is to lower our bad cholesterol. That's the LDL cholesterol. So reducing LDL cholesterol reduces heart disease risk. Treating high blood pressure reduces heart disease risk. It also reduces heart failure risk. It reduces stroke risk, as well as kidney failure risk. Reducing blood sugars also reduces the risk of cardiovascular disease, as well as coronary artery disease. So I've given you a lot of information today. So I'm still getting to the take-home points. We're not there yet, so just keep listening. I want to share some very important information with you. When you go and see your doctor will calculate cardiovascular risk score. This is a score that is used to assess your atherosclerotic cardiovascular risk and determine whether you will benefit from medications such as statin therapy or other preventative measures. So I'm just going to say this to you. When you make changes, it is always to make changes in small steps. When you make changes in small steps, those changes tend to be more sustainable and more realistic, and you can stick to those small changes. If you make changes too rapidly, more than likely you're not going to be able to sustain those changes that you've made. So let me give you a few pointers for how you can actually improve your heart health. So like I said, I mentioned small changes. So small changes to your dietary habits. So let me give you one little small change that you can make. It is so easy. You can just add vegetables to your meals. It is so simple. You can buy already cut vegetables that you can add to your meals. So that is a very simple way to reduce heart health. The second way is very easy also. It's incorporating exercise into your daily routine. So try to walk every day. My suggestion is a daily walk of 30 minutes, if possible, every day. Try to incorporate that into your daily activities. Just start and just build up to 30 minutes every day. 3, lift weights, small weights, 5-pound weights, 3 times a week. There could be those little dumbbells, and you can do the exercises at home. And don't forget to stretch. So small bouts of stretching 3 times a week, along with lifting light weights 3 times a week. So I've given you some very useful pointers for how to improve your heart health. All right, I'm going to tell you another pointer for how you can improve your heart health. Know your numbers. I'm going to tell you 3 numbers that you should know. So if you know these numbers, know your blood pressure, know what your cholesterol level is, and know what your blood glucose is. Now, when you know those numbers, if they are abnormal, you can now take the steps that you need to implement to make sure that you improve those numbers. Improving those 3 numbers will actually reduce your risk of heart disease. So now, one last thing. If you have high blood pressure, make sure that you check your blood pressure periodically to make sure that your blood pressure is well controlled. And if your blood pressure is not well controlled, see your medical provider to help you with controlling that blood pressure. So today I've shared some very simple pointers about how to improve your health. And I mentioned adding vegetables to your meals, walking every day for 30 minutes, lifting light weights, and stretching 3 times a week, knowing your numbers, knowing your blood pressure, your cholesterol, your blood glucose numbers, and seeing your healthcare provider. Also, if you have high blood pressure, monitoring your blood pressure readings. So this here, I'm providing health education content. Thank you for listening. This project is titled Heart Strong, Empowering Multicultural Communities for Cardiovascular Health. This project aims to provide cardiovascular risk education in multicultural communities in the Philadelphia area, focusing on reducing the risk of stroke or heart attack. It seeks to raise awareness, promote healthy life choices, and provide resources for early detection and prevention of cardiovascular diseases. Funding for this project was provided by Healthy Voices Impact Fund at the Community Foundation of New Jersey, which was funded by a contribution from Janssen Pharmaceuticals. This information here provided today by me is health education content and not medical advice. Thank you so much for listening. And if you found this video helpful, please share this with your family and friends. Thanks again and have a wonderful day.